Hello, everyone. Whether it is the morning, the afternoon, or evening with you, you are very welcome to this OneNeurology webinar, where we are going to talk about how we collectively advance policy and advocacy actions for neurology through data, in particular, leveraging the Global Status Report in Neurology and from our other speakers, looking at other data insights. For this session, you will see that this meeting is being recorded. Transcription services are also activated, so there should be a little button that says CC on your screen. We know that some of you will like to greet each other, particularly given this time of year. So if you want to use the chat function to do that, please feel free to do so. We are allowing some time to have questions with our speakers today. However, we ask that you use the Q&A function only for this. So the chat function will not be monitored for questions to our speakers today. We would also like to take the opportunity to thank the OneNeurology sponsors, without whom we would not be able to have this meeting with you and to share the information from this meeting to national bodies. So thank you to Roche, to UCB, to Merck, and to Lundbeck. So that's as much as you will hear from me today, except to guide you through the agenda. So first, I am very happy to share the digital platform with Professor Dr. Wolfgang Grisold, President of the World Federation of Neurology. I'm handing immediately over to you. Thank you.
Thank you. Thank you, Ola. Thank you, dear distinguished panel. My name is Wolfgang Grisold, and I'm still the President of the World Federation of Neurology. Professor Stephen Lewis, who is on the screen here too, is going to be my successor. And our CEO, Laura Drews, is also part of that meeting. The World Federation of Neurology, for all of you, is a society that has been founded in 1957. We have presently 126 member societies, the last one being Gabon in Africa. And we all have and share, and I think we share that with you, the enthusiasm to work for neurology. We may have different perspectives. There may be sometimes the elements of competition, which is good and bad. But anyway, brain health, I think, and neurology is a unifying band. And in that concept, I will go through a few words that I want to mention. The first point I want to refer very briefly is the political declaration on the fourth high-level meeting of the General Assembly at the Prevention and Control of Non-Communicable Diseases. This is a great paper, and the World Federation was also in New York, although not at every meeting because this is not easy for a non-state actor. I think the most important thing for me are two things. It is very focused on mental health, which of course is important for neurology. But if you take the word count in the document, neurology is 5 and mental health is 70. So I think there is some kind of a disproportion we have to work on. What I think and what the World Federation has to take away from that is that we have to focus on education also in primary care. The fantasy that we have enough neurologists everywhere is probably good for some countries, but not for the whole world. So mental health is very important. Primary care is very important. The third point is the Global Status Report. And as Sebastian is here, congratulations to the WHO for this monstrous and really eloquent work of analyzing all these questionnaires. I have 2 or 3 comments. One of them is burden. As neurologists and doctors, we always have to think, if we say burden, whether we are not stigmatizing people. So in the future, maybe we can use a different word instead of burden. I think brain health is a joint idea that we all have, and I think that puts us together. And what I think is very important from the status report and from the WHO is the fact that 11 million lives a year are lost due to neurologic disease. And if you look at the world data on death. Death is unpreventable. And worldwide, about 60 million people die. So 20% of the 60 million people have some kind of neurologic disease, which seems to be quite a lot and quite a big task for us. What I think is I like very much on one hand and don't like very much on the other hand is the slide in the report, in the Global Neurology report, about how many people participated so far in the IGAP. And I did not mention the IGAP yet. The IGAP is the binding element for the Global Neurology report and one of those elements that we all believe in. And I think one of our tasks will be to increase the number of countries participating in this IGAP opportunity. I have two more words. One is WHO, and I just want to report that the World Federation spends a lot of manpower and also money to attend WHO meetings internationally and now also in the regions. We also attend United Nations ECOSOC meetings. And over the last 3 years, we have done quite a lot. You can look at it at our website. There's a large table on that. And we did the exercise to look what statements we gave independently analyzed from all our statements. And the top that we mentioned was access to care and equality in access. The second point was brain health. And then we came to other topics like capacity building, the IGAP, the NCDs, and of course, the universal health care. So I think this is very important. And as the WHO meetings regionally and international always have different topics, it's not so easy to have the same wording all the time. But I think continue access to healthcare, capacity building and brain health should be our main topics. And last point for the workforce, the World Federation has been doing a lot of activities in education traditionally. We entertain 4 training centers in Africa and 1 in Mexico, which we finance. And the concept of these training centers is empower the region, because the stronger local universities are, the better for universities. We are also developing a core curriculum. And if you think of capacity, and I think that's an important point, but we always have to consider that each neurologist also needs a structure, needs instrument, and needs healthcare professionals. So these structures and the definition of those structures will be important. With that, I end, and I have just a few words on all those important things. Thank you very much.
Thank you so much, Wolfgang. The first time I met you was actually at the World Health Assembly in Geneva. And we're at a time globally that neurology, even though it had but 5 specific mentions in the political declaration on NCDs, is having a lot of momentum at regional and national level. And tremendous amount of policy and advocacy work has gone in to get to this space. If I may, Professor Stephen Lewis, as incoming president of WFN, what would be your aspirations over the next couple of years while neurology has this momentum behind it?
Well, thank you so much, Orly. You know, I think it was the early 2000s, or I think it was 1990 to 2000 was the decade of the brain. I think we're in the decade of neurology now. This is really remarkable. And as the incoming president of WFN, and I have the privilege of following in Dr. Grisold's amazing footsteps and all the work he's done to collaborate with organizations such as yours and the WHO and all of the remarkable work that's been going on, particularly with IGAP. My aspiration and my, number one on my agenda is to work closely with the WHO and continue this amazing work that Dr. Grisold has done, and so many organizations such as yours have done to improve the dissemination and implementation of IGAP, so we can find that the next global status report shows the numbers much, much greater than what we're seeing today. So much to be done, but it's a very, very exciting time for neurology and for brain health. Thank you so much.
Thank you so much, and we look forward to connecting with you more over the coming years.
I look forward to it as well.
Next on the agenda I would like to introduce Donna Walsh, who is the CEO of the International Bureau for Epilepsy and the chair of the OneNeurology partnership. So today, Donna, I know that you're going to focus very much on a very recent study, a global study looking at epilepsy, but you're coming into this with an excellent background in the development, of course, of the OneNeurology partnership, but also the adoption and now the implementation of the IGAP. And epilepsy, again, is another condition that got a very notable mention in the political declaration, features, of course, in the IGAP. We would really like to hear from you about this study and perhaps some visions and thoughts for the future. Over to you.
Thanks very much, Orla, and hello to everyone. I'm absolutely delighted to be here today in my capacity as chair, of course, of the OneNeurology partnership, but also in my role as a CEO for the International Bureau for Epilepsy. And Orla has asked me to talk a little bit about the work that we've done in the epilepsy community to really ensure that when these political frameworks like IGAP are implemented, that they actually have a tangible benefit for people living with neurological disorders on the ground. And I want to share with you a case study from ourselves in the epilepsy community. So just very briefly, for those of you who are not familiar with IBE, we are an international network whose vision is a transformational social change for people with epilepsy worldwide. So for us, we're looking beyond just the medical needs of people with epilepsy. And it's quite a big international network. So we have 160 plus chapters or member organizations in 110 countries worldwide. And you can see here from the map that we cover all regions of the world. Our goal as an organization is essentially to serve and support those chapters to ensure that they are as impactful as possible in the work that they do for people with epilepsy and those who care for them in their countries, to empower and amplify the voice of people with epilepsy, which we're seeing happen increasingly, more meaningfully, and to position epilepsy as a global public health priority, which I guess, is really sort of what we'll be talking about here today. As IBE, as Orla mentioned, we have long-standing success in this domain. If we think back to 1997, together with the International League Against Epilepsy, our healthcare professional partners, and the World Health Organization, we launched the first global campaign against epilepsy, which was called Out of the Shadows. And that paved the way for the first WHA resolution on epilepsy, and ultimately, I think, set us on the path to the intersectoral global action plan. As Orla alluded to earlier, there is a specific strategic objective on epilepsy as part of IGAP, and that is calling on governments across the world to strengthen the public health approach to epilepsy by improving access to care, but also importantly, by promoting and protecting the human rights of people with epilepsy. And so as a community, I suppose we feel a responsibility to ensure that the intersectoral global action plan is implemented in a way that can really benefit people not just living with epilepsy, but other neurological disorders across the world. Now, when the IGAP was adopted back in 2022, we asked ourselves, what would meaningful implementation of that plan actually look like for people with epilepsy around the world? And unfortunately, even as an international organization that has been around for over 60 years, we weren't really able to answer that question effectively. And that led us to the development of the Global Epilepsy Needs Study, with the question in mind of what matters most to people with epilepsy and what actions would really help us to alleviate those everyday needs for people with epilepsy across the world. So we first conducted a narrative literature review. So we wanted to understand what was already known. And ultimately what we saw was there was a lot published when it came to epilepsy around the medical needs of those with lived experience. But it was often focused on seizures, seizure burden, seizure duration, seizure frequency, and obviously so. But it was generally also from the perspective of healthcare professionals. So we could find no global data from the perspective of people with epilepsy about what mattered most to them. And as IBE, it was really important that we fill that gap. So we brought together an expert advisory board. We engaged a research organisation called Medipace based in the UK, and we developed two pretty robust research tools. The first being a survey, the second being a set of semi-structured interviews. And what was really important to us was that we co-created this study with people with lived experience. We had an initial focus group, we had extensive feedback rounds, and we pilot tested the study with our community. At the end of the study, we also put together a multi-stakeholder validation group to ensure that we were really interpreting and analysing the results that we got back and contextualising them within the lived experience of people with epilepsy. Now, of course, we looked at healthcare and well-being, we looked at mental health, we looked at sexual and reproductive health, but it was also important for us to mirror the intersectoral nature of the IGAP. And so we looked at other domains like learning and education, work and income, driving and transportation, knowledge and information, safety and security, all things that people with epilepsy had told us were important to them. And it was also important that we took an international perspective here, because very often studies are focused on specific parts of the world. And we wanted to ensure that we had data from both resource-rich settings, but also resource-limited settings. And you can see here that we have quite a wide range of differing countries included in our study. It was important we got at least 250 responses in each country, and we conducted at least 5 semi-structured interviews focusing on those who were underrepresented in our survey data. In the end, we ended up with over 5,000 responses from our 15 focus countries, and I think a nice set of varied demographics were really captured as part of this work. So you can see the majority, of course, were people with epilepsy. When caregivers responded to the study, they did it on behalf of the person with epilepsy. So we didn't specifically collect caregiver needs. You can see mostly respondents were in urban areas, but we also had quite a number in suburban and rural areas. As is typical, mostly females completing the survey, but we still had 35% of males. An even split between middle and high income, but also over 10% of respondents from low income countries, where we had to take really an adapted approach to how the study was delivered. In Uganda, for example, our team on the ground had one laptop. They had to go to rural treatment camps where there isn't even a written language, asked people orally to complete the study, and then retrospectively added the data in at the end. So we really ensured that we were able to collect data from every part of the world to ensure that we had something robust that we could share later on. And you can also see here a nice spread of ages, and epilepsy is a condition that does affect people across the life course. So we are just about to resubmit our publication to Epilepsy at Open. So we've had our first round of revisions from our reviewers. Nothing insurmountable, thankfully. So we've gone back with our updated manuscript, and we are hoping that the research article will be published early in the new year. So today I'm not going to share the full set of results because you'll be able to read the paper soon enough, but I will give you a brief overview of what we found. So based on what the statisticians did in terms of bringing together the qual and quant data, we managed to come up with 5 sort of generalized statements or themes, which we feel really sort of brought together the needs of our community in a way that's, I suppose, quite easy to understand. Number 1 was around navigating uncertainty and redefining daily life. So if you're living with epilepsy, you often don't know where or when you will have a seizure and what that will mean. And that level of uncertainty has a huge impact on individuals affected. Relatedly, of course, living with that risk, but also the ongoing social exclusion and misunderstanding that we see with epilepsy, but also the stigma that exists around many other neurological conditions. Challenges to navigating inaccessible systems, and yes, we're talking about healthcare systems here, but we're also speaking about wider societal infrastructures like public transport, for example, or educational and employment settings that are not set up to really be epilepsy friendly. Consequences of inaccessible or inadequate information, including information from healthcare professionals, and the sort of health literacy of those receiving that information to be able to actually understand and use the information provided. And of course, we know that many epilepsies are rare, and standard approaches to those epilepsies really are not adequate across the world. What I want to do, though, in the couple of minutes I have left is to really take a look at whether the findings from our study actually align with the strategic objectives of the Intersectoral Global Action Plan. So down the right-hand side of this slide, you'll see the 5 IGAP strategic objectives. Down the left-hand side, you'll see the top 10 most urgent needs across the domains communicated to us by people with epilepsy across the world. And from my perspective, I think actually there's a really nice fit. And what this suggests to me is that the IGAP framework can and should be used to drive change for people with epilepsy on the ground across the world. So the first 2 needs from 2 separate domains are basically the same, talking about the need to recognize and defend the rights of people with epilepsy. And of course, that pretty much mirrors the text that we see in strategic objective number 5 when we speak specifically about epilepsy, but it also speaks to strategic objective number 1, which is around raising policy prioritization and strengthening governance. In terms of the needs you see here in grey, 3, 5, 6, and 8, these are very much around ensuring people have access to healthcare professionals, that they are prescribed a treatment quickly, and that they have ongoing access to that treatment. But it's not just around anti-seizure medicines for people with epilepsy, and you also see many people expressing the need to have access to affordable mental health care that is specific and tailored to people with epilepsy. And to me, that very much speaks, of course, to strategic objective number 2, which is around providing that effective diagnosis, treatment, and care. And then the needs that I have highlighted here in red very much speak to the need to increase awareness of epilepsy, to ensure that if somebody has a seizure in public, including on public transport, that they will be safe, they will get the support that they need, and that there will be some level of basic seizure first aid knowledge within societies and communities. And again here, I've mapped this onto strategic objective number 3, because I think it speaks to that need for greater health promotion. But of course, I think we could easily also see these needs addressed under the 1st and 5th objectives as well. And for me, of course, research and innovation underpins all of this. So ultimately, and I think if you look across the data set that we have generated, we now have information, robust scientific information that we can actually use to drive our policy advocacy when it comes to implementing the Intersectoral Global Action Plan or other political frameworks that we see at a global, regional, or national level. So just very briefly, because I realize we're coming to the end of my 10 minutes, we are, as I said, resubmitting our publication. We hope that it will be available very soon. But we're also working on a policy advocacy report, which will be contextualized within the strategic objectives of the Intersectoral Global Action Plan, and which will also build upon the outputs of the Global Neurology Status Report, which Sebastian will present later on. So it's really important for us that the advocacy policy tools and templates we build on the back of this study are very much grounded in those political frameworks that we can leverage to address the needs that we have collected from our community. We will also do some deeper dives into some of the subpopulations where we saw a statistically significant more needs, like in the area of women. So we saw many more needs in women with epilepsy compared to men across a number of the domains. We'll do a little bit more work on digging into the needs of caregivers, which wasn't the focus of this study, but indirectly started to emerge, particularly in the interview phase. And we will ensure that we take a closer look at those living in low-income settings where the real burden, anecdotally we know lies, but I think proven now by the data that we have generated. And there'll be some specific work on rare and complex epilepsies as we move into next year. So for us, we really do see this as a first of its kind global study, at least in our epilepsy community. Important that it was delivered with and by our community and very much reflects that person-centered approach of IGAP. We have a really comprehensive data set now that we can use to drive progress when it comes to IGAP implementation. but can also shape the wider work that we need to do, because knowing needs is not enough. Having a global framework is not enough. We need to build the capacity of our community to advocate for change. Webinars like this are hugely important as forums to exchange knowledge and to build out partnerships, because I'm pretty sure a lot of the needs that we have seen in the epilepsy community are needs that are reflected across the wider neurology community. And for us, if we can use the presence of epilepsy in the text or in other forums to bring along the wider community and to work together on things of mutual interest and of mutual concern, I think it can only benefit everybody. So I'm not going to go through this list. Some of you here today will spot your name on here, but this was a huge team effort for us to get this off the ground. If people do want to scan the QR code on the screen, then you'll be able to read the draft manuscript on the preprint server. That will, of course, change because we're already actioning the reviewers' comments, but it will give you a sense of the direction of travel of this piece of work. And there are a multitude of supplementary materials that we have put together that can be accessed to allow us to continue to really mine that data and to continue to ensure that our policy advocacy is evidence-based and is really informed by the true needs of our community. So thank you, Orla, for the opportunity to present today. And hopefully, we will be able to work together to action some of these needs moving forward.
Thank you so much, Donna. So a number of comments of congratulations on the work have come through, and also addressing a couple of the other comments. That's the first time I've seen a QR code with a pre-publication information access portal. This is phenomenal. This is great. So for those of you asking about that, I hope you took your phones out and took a scan of that QR code. And the second part of that question is, when the publication does finally come, that journal is open access, is it?
Yes, it is. So we've submitted it to Epilepsy Open because we want to ensure absolutely that the data is available to everyone, particularly our own community who, we couldn't have actually done the study without. So for us, it's a decision that we've taken to ensure that any publications that we put out as IBE will be available open access, even though it's not the least expensive thing you'll ever do. But I think it is important that we commit to that as organizations representing people with lived experience.
Thank you so much, Donna. And the same threads are coming through from Professor Grisold and then following through with IBE around the stigma and the rights of people living with epilepsy and other neurological conditions. When we talk about access to services and supports, it's really the workforce that we need. And we want to promote and encourage as many people to follow through with medicine and ultimately to neurology as well. Because looking at epilepsy alone, there is a huge need, particularly, as you mentioned, in low and middle income countries. And we're aware as the OneNeurology partnership of other very prevalent conditions that have huge numbers associated with them as well. This is a great entry point to then bring us to the very recent publication from the World Health Organization. Dr. Sebastian Winter, brain health consultant with the WHO. This is a body of work that has been sought after for many years. And I think following Donna's presentation, we will have a number of other condition-specific groups, most certainly hoping that their data will be in a next or the next iteration of this work. But let's not get ahead of ourselves. Sebastian, I'm going to hand over to you to share some insights on the Global Status Report on Neurology. Over to you.
Yeah, thank you so much, Orla, for the kind introduction and kind invitation to join this webinar, and esteemed panelists and participants. It's my great pleasure on behalf of the World Health Organization to present on the Global Status Report on Neurology. And we have already heard by the previous speakers about the manifold initiatives that are underway to address these 5 strategic objectives and eventually meet the 10 global targets of the Global Action Plan. I think it's just a collective reminder for us that we're now in the third year of the Global Action Plan, and we really need to now push down on the gas pedal to accelerate action collectively if we are to meet these ambitious targets. And I think the bottom line here on the slide is the important one. It's not just actions for the member states and for the WHO Secretariat, but very much also for the international and national partners such as yourselves. And it's truly, I think, the advocacy and the partnerships that need strengthening and that have shown us, I think, the significance of what we can do if we come together as a group and advocate for neurology as one. Certainly as WHO, we see ourselves in a convening role, and we involve people with lived experience in all of our activities. We also have regular NGO meetings with the partners and take pride in being able to participate also in civil society-led activities. I think this webinar is a great testament to our collective efforts. Of course, it goes hand in hand with strengthening regional and national capacity building through workshops and in-country work. And we've already spoken about the declaration of the fourth high-level meeting on NCDs and mental health, where of course, more work needs to be done, but we have seen explicit recognition of neurological conditions. We have seen a global call to integrate neurology into NCDs through the concepts of universal health coverage and primary health care, and of course also commitments by the member states for services scale up, access to medicines and technologies, as well as data and monitoring on NCDs, mental health and neurological conditions. And speaking of the monitoring, I just want to very briefly speak about the methodology of the Global Status Report. This really was a Herculean task over the past 2 years to bring together data. We had well over several hundred individuals contributing to that report, and the idea was to establish a global baseline against the 10 targets. Number one, to establish a global coordination mechanism and a monitoring mechanism, but also as a second step to be able to track progress and identify where are the key gaps and needs, and use that data to inform targeted recommendations for the member states. And so this was done through a survey process disseminated to all member states, and the data was validated by ministries of health and then shared with WHO. Again, we had consultations with people with lived experience very early from the outset, and you will see this as a kind of red thread throughout the report, because we have asked them, what are your key messages to policymakers? What are your key asks and unmet needs? What are good practices and opportunities to support and work with people with lived experience to implement the activities of the Global Action Plan? Wolfgang has already emphasized the need that we need to really double down on getting the participant rate up. You can see here the response rate. So we have a decent global spread, I think, and we're covering 71% of the world's population with the countries that have responded. Nevertheless, this only represents really 53% of all member states. And I think it gives us really two reasons here, or two ideas to think about. Number one, that neurology is still not recognized at the very top of the global health agenda, and we need to do more to advocate for that and to sensitize the countries. And secondly, that a lot of the countries actually just don't have the data necessarily that we were asking them for. And this goes to show the criticality to strengthen health information systems at a national level, to embed indicators on neurology robustly into these national systems so that we have a better database. Let me jump then directly into the findings, and again, picking up from what Wolfgang said about the global burden and the GBD, the Global Burden of Disease Study. Perhaps a better word is impact, the impact of these conditions. It's above my pay grade to decide on that, but I think, talking about the impact, we see that, of course, just these 37 conditions alone were responsible for over 400 million disability-adjusted life years. And the bottom line here is that 85%, so the bulk of the impact, is in low and middle income countries, where, of course, we have many challenges, and we have already, previous speakers have already addressed some of these. Yeah, there's also a section in the report on not just the health impact, but also the economic impact of neurological conditions, where we discuss the literature on this. And of course, there are many gaps, but some studies are worth highlighting and to make the point. And one is by Mitchell et al., a recent study published in the Lancet Public Health, where they looked at 24 brain disorders, so 10 neurological conditions and 14 mental health conditions, and they just looked at the direct spending. So this does not account for productivity losses or the impacts of informal caregiving. And just for these 24 conditions, we see here an annual spend of 1.7 trillion US dollars, equivalent to 1.6% of the global GDP. So this is an enormous figure. And in fact, the authors have mapped out since 2000 that there has been a 3.5% annual increase in that spending. So a huge also economic cost to the global economy associated with neurological conditions. Yeah, jumping then directly into the data for the first target, and we've heard nicely also from Donna how relevant these targets are for people with lived experience. I think this was a great presentation and a great slide to show. And it really, here in terms of the baseline, we see that we need to do a lot more. So we have less than a third of countries actually saying, yes, we have a national policy on neurological conditions integrated in our policy strategies, plans, or frameworks. And even fewer, actually only 1 in 4, say they have national awareness campaigns and advocacy programs. If we zoom in on this a little bit and look at where policies are integrated into, we find that these are typically integrated into mental health policies, general health policies, policies on disabilities, and NCDs. But actually only a handful of countries, 16 countries here, report standalone policies on specific neurological conditions or brain health. And these tend to be mostly actually high-income countries. Again, I've already said that only 1 in 4 member states have campaigns. And here we also see disparities, so fewer campaigns existing in low-income countries. And if you look at the bottom right-hand side, a majority of countries say, yes, we do provide dedicated financial human resources and we have a defined implementation plan, but only just over a third actually have a monitoring and evaluation framework in place to actually showcase the impact that these campaigns have. And that's, of course, ultimately what we want to know. We want to understand what works, and if it doesn't work, how can we change it and how can we scale it effectively? Yeah, the countries were also asked about financing. And again, we're seeing a huge gap here. So just 1 in 3 responding countries actually say they allocate dedicated funding to brain health. And this challenge is further compounded really by prohibitive out-of-pocket costs, especially in low-resource settings. You see this on the right-hand side, the financing of access to care on the top right-hand side, and the bottom right-hand side, the financing of access to medicines, where we see a significant impact in low and lower middle income countries in terms of out-of-pocket spending, up to 50% being the yellow bar, and over 50% out-of-pocket spending being the red bar. So here really this it has tremendous financial impact for individuals affected and their carers and families, which we need to consider. For diagnosis, treatment, and care, these were the 2 overarching targets for countries to integrate neurological disorders into their universal health coverage benefits packages. And only 1 in 4 countries say that they currently have them integrated into their UHC packages. Also, just a little bit more, 29% of countries say at baseline they are providing the essential medicines and basic technologies required to manage neurological disorders in primary care. And again, if we disentangle that a bit, we see the same pattern of inequity. So nearly twice as many high-income countries report they have neurological conditions included in UHC compared to low-income countries. And there's even an order of magnitude higher reporting by high-income countries that they have social protection mechanisms as opposed to very few low-income countries reporting these mechanisms for people with neurological conditions. Yeah, the countries were also surveyed on the types of services that are available. And the good news is there are 84% of countries are saying we have some services available in specialized settings. Unfortunately, only 50% provide them both in specialized and in more generic non-specialized settings. And on the left-hand side, the table, you also see that essential services for neurology, like stroke units, neuro ICUs, rehabilitation, palliative care, and pediatric neurology services are quite scarce actually in low and middle income countries. And that is further compounded the problem by a large urban-rural divide. So again, we see, and this is the red and yellow bars, that these services tend to be concentrated in the capital or in urban areas in low resource settings, whereas in high income countries, at least there's some extent also of rural coverage. In terms of access to medicines and technologies, this is another a huge area, of course, and the previous speakers have addressed this. The countries were surveyed on a basket of 14 essential medicines, including anti-seizure medicines, pain medication, migraine medication, and Parkinson medication. And while you see that for some of these medicines, such as paracetamol and ibuprofen, they tend to be more ubiquitously available, we see a shortfall here with fewer than half of the countries saying we have newer anti-seizure medicines such as levetiracetam or anti-migraine medications such as sumatriptan or Parkinson medications. And that is again compounded in the low resource settings through urban concentration and high out-of-pocket costs of these critical resources. Yeah, we spoke already about workforce capacity, and Wolfgang has addressed also and shared how the WFN is supporting and building capacity for workforce globally, and we cannot overemphasize the importance. Here you would have perhaps seen this social media tile that was shared together with the publication of the status report, and I think it really says it all. I mean, we have the bulk of the impact in LMICs, yet low-income countries report having up to 80 times fewer neurologists per 100,000 population compared to high-income countries. So a lot more that we must do to build that capacity. And this is reflected very much in the training, also at primary healthcare level, where we do see some training of generalist medical practitioners, but we need to broaden that training to also include other critical health workers, such as community health workers, nurses, pharmacists. This is not being done enough yet, and we need to close that gap. And similarly, in low-income settings, we find that just over 1 in 3 low-income countries say they have actually national guidelines available for neurological conditions. The situation is even more dismal for carer services and protections. These, both services and supports, as well as social and financial protection mechanisms, are virtually absent in the low-income countries who responded, whereas the majority, as you can see here, of high-income nations actually provide these services. There's, of course, also the target on promotion and prevention. It has already been mentioned, and we think this is a very big missed opportunity here. So we have at baseline only 1 in 5 countries, 20% saying they have such a program, an intersectoral program on brain health promotion or prevention of neurological disorders in place at the national level. And we also see that reflected in the other target, which talks to the targets of other reporting mechanisms and mandates, such as the NCD Global Action Plan, the Defeating Meningitis Roadmap, and the Every Newborn Action Plan. All of these targets, and many of them are relevant to brain health, but we see here on the right-hand side, if we take stock, we see that these targets are very much off track. So we have a rising prevalence of physical inactivity, of obesity, of diabetes, and that is reflected, of course, in the neurology realm, with now diabetic neuropathy being the fastest rising growing neurological condition in the latest global burden of disease study. We have seen, of course, some improvements in meningitis prevention and control over the past decade, but the burden still remains high, especially in low and middle income countries. And if we take a look at the Every Woman, Every Newborn Action Plan targets, projections actually show that most countries will fall short of meeting those targets in 2025. So again, reaffirming the commitment to anchor brain health really throughout the life course, especially in the early critical period, and supporting maternal and newborn health. There was also a target on specifically on research and information systems, and countries were asked to, if they are able to routinely collect and report on a core set of indicators for neurological disorders through their health information systems. And just over a third actually said they were able to do this reporting, which just goes to show the criticality for us to strengthen health information systems for neurology at national level in the countries. We also had a centrally populated indicator on the research output with a target to double that output by 2031. And we have calculated here the share of neurological disorders research as a share of overall health research, and this is 6.7% in 2022. So we need to strengthen research to be able to double that within the next 7 to 8 years. Just to put that into perspective, so mental health research actually currently sits at 4%. Neurology is somewhat in the upper middle field, slightly leading cardiovascular diseases, but trailing cancer. And we see, importantly, huge disparities when we break it down by regions or by income groups. You can appreciate here on the left-hand side that some regions are leading, such as the European region, whereas other regions, especially in the global south, are trailing. And we need to almost flip that and support the global south and build capacity in the global south for stronger research. And on the right-hand side, you see some of the reasons for that. Again, countries were asked if they provide dedicated government funding for research, and you can appreciate that this is virtually absent in the low-income countries who responded. So there's an urgent need also to build capacity in many regions on research. Yeah, in terms of data collection, I've already said that it's only just over a third who reported they were able to report on these core indicators. And it's really a two-pronged problem because quite often countries actually lack the integration of indicators in the health information systems, which means they are not collecting this data to begin with. But then also among the countries who do collect that data, we see that only a handful, really 16 countries, say they're publishing dedicated reports and are actually using that data to inform policy planning and management. So we need to do more on both fronts, not just the data collection part, but also what do we do with that data? How can we effectively use that, not just for advocacy, but also to inform policy planning and management? And then finally, the target or the strategic objective on epilepsy, again, with two global targets, one being to increase epilepsy service coverage by 50% from the current coverage levels. This was a hugely difficult indicator to calculate and to get the data from the member states. So take this with a grain of salt. We see that 49% was the global median epilepsy service coverage, but this is based on data from just 18 countries. So at the end, it was very difficult to validate that data. There were challenges with over and under reporting of service coverage. And it just goes to show the difficulty of even an indicator that should be a central indicator for any healthcare system can be challenging to calculate based on the current health information system infrastructure that is the reality in many countries. And we've heard from Donna also some of the difficulties of actually getting data on the ground. So a huge impetus needs to be placed on this. And this goes hand in hand with also the second target here, which is on promoting and protecting the human rights of people with epilepsy. Countries were asked, have they developed or updated their existing legislation? And actually only 1/4 of them have said, yes, they have done this, again, with the disparities being mostly apparent in low resource settings. Yeah, so this was a lot of data, and it was really just a snapshot of what the report entails. But I think what we see from this, and all of us are aware that we have this growing impact, both a health, social and economic impact of the conditions, and low and middle income countries actually face the heaviest burden or impact of the conditions, but have the fewest resources available to them. And it's not to say that we are at zero. We have seen actually progress, and there are a lot of initiatives happening on the ground, many of which are featured and included in the report, but there are clear gaps really across all components of the healthcare system, and we must accelerate now dramatically in order to be able to meet these targets and tackle pervasive barriers such as stigma, workforce shortages, limited care support, restricted access to medicines and technologies, because otherwise we will just deepen the inequalities. And we need to actually use all the levers that we have at our disposal, and that includes brain health promotion and prevention efforts, which are still missed opportunities by the countries. Yeah, the report concludes with a forward-facing chapters on 4 overarching recommendations, including making neurological disorders a policy priority, expanding access to neurological care, promoting brain health across the life course, and strengthening data systems and monitoring. And concretely, what does this actually mean? So if we look at disorders as a policy priority, it is about supporting the countries and putting them in a position where they can develop and implement context-specific, tailored to local needs, policies that truly address the needs of people with neurological conditions. And we have seen and heard already about many excellent efforts in this vein, including by partners who are here on this call. And I'm sure we'll hear also from Fred about some of the initiatives that are ongoing with at the European level through EBC. Of course, more needs to be done also to implement sustainable health financing mechanisms and also improve the financial and social protection mechanisms where we've seen these critical gaps and out-of-pocket costs. Yeah, expanding access to neurological care. This is critical through integrated person-centered care pathways embedded in UHC, and there are many initiatives also included in the report and shared by the partners. One of them is the WHO Special Initiative for Mental Health, which seeks to leverage the concept of UHC and is working across 4 continents to provide more care for mental, neurological, and substance use conditions, including through strengthening primary healthcare by implementing the MHGAP training module. And there are many other initiatives happening also at local level and community level. I won't go into detail on this, but we have heard also here today from many partners about several ongoing initiatives. Mainstreaming brain health in all policies, we need to do more on this, and I've seen a lot of wonderful initiatives, one being the Karnataka Brain Health Initiative in India, where they've established over 30 brain health clinics, very much close to the community, including brain health promotion and prevention programs, but also advocacy and policy advocacy, which has now led to the establishment of a national brain health task force in India. So these initiatives are very critical, and we need to see more of them and also go beyond the realm of healthcare. Just mentioning here one element of mainstreaming brain health into sports, specifically the WHO FIFA awareness campaign on concussion, which was one project we were involved in. And so whether that's sports or employment or education, really this intersectoral approach is what will help us to get there and anchor brain health on the map. And strengthening data systems and monitoring. And I think this is now comes full circle with what I showed you earlier on the lack of data in many instances and many regions. So mobilizing more resources for research on neurological disorders. We've heard a fantastic example from Donna with the Global Epilepsy Needs Study. There are other examples of implementation research. Some of them are included in the report, including the EPINA project, the TRAPCAF project for epilepsy and Parkinson's, respectively, as well as at global level, the Lancet Commission on Neurorehabilitation, which seeks to develop evidence-informed pragmatic solutions, especially also in low-income settings. And hand in hand with this implementation research, of course, scaling and being able to capacitate health information systems through the use, including of digital tools and AI. And that brings me to my final slide. Then, what are the next steps for action? Really, I cannot overemphasize the criticality to foster partnerships and strategic collaboration. We need to now more than ever intensify our collaboration. And Wolfgang has mentioned it. Competition can be good and bad, but I think the important point is that we all come together and also advocate for neurology as one, which is also the mandate of the OneNeurology partnership. And this is not just coordinating across WHO's levels and governments, but also engaging more with civil society. And we're very grateful to be a part of that and to see also have civil society have ownership of IGAP priorities. I already spoke about data systems and reporting, but just to say that accelerating this country level implementation on the ground is critical. So capacitating the countries and country readiness for IGAP implementation through capacity building workshops and a replication of good practices and things that frankly just work and are scalable in the countries. And the last point would be to keep the momentum, to not get discouraged and leverage really all the resources that we have at our disposal. We are hugely grateful for the co-creation of the Global Status Report with all of you. And now that we have all of this data, the next step is to put it to good use and to use it for our advocacy and to support the countries with it, to share it widely. And we're hugely grateful to all of you in helping us do that. And I just want to acknowledge also our team, our whole unit who has contributed to that process, led by Tarun Dua and Nirja Chowdhury, Katrin Sea, and others who have spearheaded this effort. So thank you all so much, and back to you, Orla.
Thank you so much, Sebastian. So a couple of messages have come through around sharing the slides, which I imagine we were allowed to do so. And within your slide deck, there is a link to the report. So for those asking for the report itself, it is huge. So huge thank you for condensing as much as you could into that slide deck. It will definitely be used a lot. Thanks again have come in from groups representing meningitis and encephalitis, because naturally throughout this year, looking with that focus on the political declaration of NCDs, sometimes other conditions might feel like they have been overlooked, but it was great to see them very much included and referred to throughout your presentation. I'm just doing a little bit of housekeeping in terms of the comments that have come in here. Now, I didn't recognize, so forgive me, all of the drugs that were mentioned in terms of their rates of accessibility, but two other groups that are very keen to have treatment made accessible, particularly in low and middle income countries, are the multiple sclerosis group, and obviously with major changes happening in the Alzheimer's and dementia space, we do anticipate that they are included. Maybe they were, maybe, I don't know if you can speak to that, Sebastian.
Thanks so much, Orla. Yes, so specifically multiple sclerosis, I think we did include and have a case study on MSIF, and thanks to the MS International Federation for sharing that on upscaling care, diagnosis, treatment, and care in Egypt. I think it was. And with regards to dementia, we have this featured also as part of the forthcoming update of the dementia risk reduction guidelines. Mind you, we do have a standalone, separate action plan on dementia. So dementia was not included as a tracer condition in the reporting for IGAP deliberately, because we have this global reporting through the GDO portal, which is also accessible with the latest data also online. I think maybe perhaps a quick general word. We always try to strike a good balance across all different conditions. We need to be mindful of geographical representation and many different variables that feed into that. But I think the overarching approach should be the integrated approach to advocate for neurology as one, and to ensure that we can integrate it into existing structures to reduce duplications and disease-specific fragmentation. So this is something that we very much try to do, but of course, we cannot always do justice to all different conditions. Otherwise, the report would be much longer than its current 300 pages. But yeah, thank you very much for the important comment.
Thank you. A long question that came in, but I think if I can condense it, the WHO has done the fantastic work of generating this report. We know you're engaging in several meetings and webinars to disseminate this via NGOs, via webinars like this. The question asks, a bit cheeky, are you doing anything more? So maybe are you engaging with member states with respect to this report? Could you comment on that?
Absolutely. Yeah. Thank you so much. Excellent question. Yes, we are doing more. And as I've said in one of the previous slides, it's absolutely critical to build capacity across the 3 levels, and for this to really not just trickle down, but also proactively by the member states for them to use this as a resource. And the important bit is really that it's not just published and it sits on a server somewhere, but that it's put into action. We do have the complementary IGAP implementation toolkit, and we are working not just with the regions in terms of regional webinars and capacity building workshops, but also going into the countries as WHO, working with civil society partners, working with governments, with people with lived experience and advocates on the ground in several regions. Particularly in low middle income countries. There are many ongoing projects, for instance, in the African regions in several countries. There was recently an IGAP inter-country learning workshop in sub-Saharan Africa that took place where many commitments were made. There have been several workshops also on fostering access to medicines, essential medicines, and getting them reimbursed through national health insurance coverage also in the African region. And I was involved personally in a project recently in Eastern Europe and the Republic of Moldova, where we worked with the National Neurology Society and the Ministry of Health to develop a joint IGAP declaration and to adapt the IGAP framework to the national context in Moldova, and that project is ongoing. So there are many country initiatives, and this is actually absolutely critical that this will eventually, all of this translates to in-country work, and that the countries and all relevant actors in the countries are capacitated to use this and make it their own and tailor it. And that's really the nature and the flexibility of that IGAP framework, that it is eventually domesticated and put into national policies and put to good use. Thanks.
Thank you. That was a good and lengthy answer to the vast amount of work that's ongoing to implement IGAP and to utilize the data from this report. This is leading in nicely to the chat that we will have with Fred Desterbeck. However, one thing I noticed as we went through the slides and we talked about civil societies, we talked about the need for policy and advocacy pursuit from the clinical groups, from civil societies, NGOs. I see at least 2 or 3 industry stakeholders on this call, and the WHO actually have a fantastic IGAP toolkit, and there is indeed a role for you, believe it or not, industry stakeholders, in supporting the implementation of the IGAP. So this is our promise, is that all of the toolkits that are mentioned throughout this webinar, we will send that to everyone who is registered and everyone who has asked for the recording. We will send all of the tools through with that. I won't promise it will be today, but within the next week or so, you'll all have access to that because everyone really has a role to play. Thank you so much, Sebastian, for now. And with that, I would like to introduce Fred Desterbeck, who is, among many things, the CEO of the European Brain Council. Fred, thank you so much for joining the webinar today. We have planned to pick your brain around Europe, but I couldn't let it go without mentioning the fact that you have huge insight into global activity for brain health with respect to countries that have developed or are developing brain health plans. And if I may throw you off kilter and maybe ask about that first before we bring it down to the European level. I know at the past couple of side events that you've hosted at the UN, there have been countries represented that are doing phenomenal work. And I wonder if you could maybe share some insight into that, because I believe the stats for 1 in 5 countries have intersectoral brain health plans in place. There's issues around funding towards brain health plans. But you are aware of some major successful stories in this space. So if I could hand over to you.
Yeah, thank you, Ola, and thank you for the invitation and opportunity to contribute to today's event. I mean, it's really humbly that I'm happy to share the insights that we have aggregated at EBC, in the sense that we recognize rather a role of facilitation in aggregating, let's say, the knowledge sharing But there is a lot of initiatives and actions that we have been seeing, obviously across Europe, work in monitoring and coordinating national brain councils, but as you pointed out, also beyond the boundaries of the European Union, within the European WHO region, but also beyond. As now the cross connection and thanks to the impulse of the IGAP, we should say, there is definitely a momentum that we see is being picked up from different angles across countries. And obviously, depending on the region of the world, and I think Sebastian and Donna brilliantly expressed that, we have different momentum of maturity, but also different needs that ought to be addressed depending on the reality on the ground, but also the policy agenda and the policy momentum, or I would say pre-existing initiatives. So that's where the knowledge sharing and the sharing of experience is extremely important in our eyes, in order to ensure that we can definitely learn from successors, and also then find common ways or common solution in addressing some of the challenges. You mentioned funding, but there are definitely others. I think that the mere recognition of neurology as a priority need is an issue in itself. And I think I remember previous meetings of the OneNeurology group where we identified that the awareness raising on the mere existence of the IGAP was an issue in itself. So now comes the point also of how to ensure that there is a greater deal of recognition of the need for action here. So we had a discussion about the data, about the need for action. I think that the Global Status Report is definitely a fantastic tool there. There are additional resources that ought to be pulled and used for that purpose. But I think that we should also maybe shed light on the notion of intersectoral in the Global Action Plan. This is probably something that we haven't spent enough time talking about. And that's also something that we have tried to shed light upon in our various events, and particularly in the context of the Science Summit in New York during the UN General Assembly, because this is really the example where we have given or let's say opened the door to, in terms of, okay, brain health is important, healthy brains in our society is important. So that means being able to deal with prevention and health promotion strategies, but also then to curb the burden of disease. But then what does it mean, and how can we go the extra mile in addressing healthy brains across the life course? And so that means that we then start incorporating issues that were not always necessarily, and I would say very consciously, within our radar, like the early days after birth, but also I would say all the pre-birth brain development, and that would really encompass areas of policy action. As I said, that we didn't necessarily prioritize like maternal care, like education, like social policies, and then embracing the whole spectrum of socioeconomic risk factors. But then also, very interestingly, we incorporated within the agenda of our events issues around like the built environment. And I think Donna alluded to it in her presentation, how to build epilepsy-friendly care facilities, and so on and so forth. But then we also had architects and designers who said, like, look, we learned from neuroscience how to make sure that we can improve well-being of people turning up to work when we design a working space in such a way, or when we design different neighborhoods and we think the urban planning in a different way. So these are really examples as to how we have an implementation of these different elements. And obviously, I mean, we now have the challenge of seeking implementation of that at the national level. and making sure that we have a resonance. You ask about countries, let's say, and success stories and good examples, and I'll finish off there because I've got the feeling of rambling on way too much. Traditionally, we have had Norway as a front runner with their national strategy having been, let's say, adopted, recognized by the government since really a number of years. It's a fantastic success story, but also learning or coming with a lot of learnings, which is like the moment your plan or your national plan is coming about and is endorsed by the government is not the achievement and the end of the work, it's only the start. Because we need to then seek the implementation of all the recommendations that we are putting forward. That's what the Norwegian Brain Council is very hardly working on with a 2-year implementation plan every single time. I think that what Sebastian shared with us in terms of this is not the way the implementation of the IGAP is coming along is a good example of that. So that needs to be replicated at country level. And we now have other countries such as Spain, Switzerland, Poland, all coming really and following the trail. Only to quote a few, and it's now part of our remit as EBC, but also as all players to try and support the development and the emergence of this plan.
Thank you, Fred. A lot of this has come from, as you rightly mentioned, the push from the adoption of the IGAP initially. We in Europe, we see a huge momentum for brain health and neurology when it comes to research, when it comes to policy work. My question centers around the anticipation that we have for neurology. And I want to preempt that by saying, you know, in the presentation from the WHO, we see 37 conditions mentioned. We're acutely aware in Europe, both EBC and EFNA and many other organizations, that there is a huge rare disease component to neurology, or indeed you could phrase it the other way, that neurology is deeply embedded in many rare diseases. Do you think some of that has fed into what we see on a policy level as we enter into 2026? And do you think that policy implementation, and you can speak to the two items I'm referring to around rare and around neurology, do you think that will feed into further development of national brain health or neurology plans? Will that help mobilize national brain councils or other national groups advocating for neurological conditions?
Well, yes, I mean, undoubtedly, and that's exactly, let's say, the role that we intend to play, is that we are now, let's say, receiving from the global stage or international institutions some degree of guidance, directions, objectives about a common need and a common challenge and how to address it. Member states start to pick it up, and we see the increased recognition of the need to establish those national plans. But our role at, I would say, a sub-regional level was to make sure that we have that degree of coordination in the emergence of those plans, because particularly if we now shed light on or have a lens on Europe more specifically, we certainly didn't want to see member states implementing the IGAP as well as the other plans on dementia and mental health into something really fleshed out, but that this implementation starts to go into completely different ways, and we have major discrepancies across countries, whilst we have, let's say, in our culture, this need to find a greater degree of cohesion, but also this idea of trying to integrate what can be integrated and share what can be shared in order to find those levels of efficiencies. Hence our call to for the European Union to consider the adoption of an EU coordination plan, and we called it a coordination plan really with that spirit of embedding what those national initiatives would actually leverage. But this coordination plan and the recognition of the need for a brain plan is really coming about. But as you rightly said, Ola, in conjunction with the recognition of a rare disease plan really being put to the fore at the same time. So we are really trying to work on the interconnectivity and synergy between those different initiatives, because we recognize the great benefit of being able to work on the basis of a rare disease plan, but we would certainly miss out on a number of priorities if we were, let's say, summarizing the needs of the neurological community as being similar to what we experience in rare diseases. But this being said, we need to be cognizant and aware of, let's say, the many synergies that we can leverage there in terms of advancing research, support to patients, caregivers, and so on and so forth. So there are definitely, let's say, common threads, common signals, and common strategies that we can put in place. But I think we need to keep really a neurological plan in its own right. And this is what the European Parliament is up to doing by looking into the development of a neurological health strategy towards 2026. And obviously, together with EFNA, YEN, and all the players in the community, we are up to really contributing to this very actively.
Fred, a question has come in around, I think it's an obvious yes, we would love to say an answer to that. Do you think there should be an obligation for each European country to have a hospital to report to the European Reference Network? So in this example, it's ERN or ND, noting that for neurology and brain health, there's 4 to 6 European reference networks that are applicable to all the conditions that fall underneath that. So if we narrow it down, do you think there should be an obligation to every European country to report to an ERN that has a neurological component to it?
Yeah, well, I would say yes, definitely. The thing is, can we ask for smaller countries like, Luxembourg, Malta, to have and to invest the resources themselves into building an hospital and be the reference center in the country? I think there we need to find ways to address the lack of capacity in dedicating resources from really small players. And that's actually what is standing behind the principle and the proposal of establishing the reference networks, is that those smaller countries not necessarily having the resources to deal with the with rarer conditions on their territory, to then rely on a network at a European level. This is really where we could demonstrate added value of an action at the EU level, as we all know that the European Union doesn't have any privilege legally to intervene into the organization and the financing of care within member states, unless it can then play a role that the countries cannot perform. And this would be the case with rare diseases and ERNs.
Thank you, Fred. With one eye on the clock, I am going to also ask one last question around research. So we saw that in terms of neurological research, we're sitting at around 6.7%, if I remember this statistic correctly, compared to other health research. We're hoping for a bigger push in Europe on this next year. Would you like to maybe comment on that? And I'm also conscious that graph showed that Europe was a little bit ahead of the US. I know we have some US advocates on the call as well. Maybe I shouldn't have said that. So Fred, I'll let you address that, the advances in research in the brain health space in Europe in 2026.
Thanks, Ola. Well, couple of comments. The first one is that EBC's priority and call at policy level has always been and will always remain, as far as I'm concerned, that the investment into brain research need to be commensurate to the burden. So as we look at the figures and the maths, this is definitely an issue. and a lot needs to be done and remains to be done. We even make the math and push it to some extreme a couple of years ago when we came out with the figure of saying like the level of investments by the European Commission into brain research is comparable to offering one espresso to each person living with a brain condition every year. So this is let's say the degree of comparison. So our call to do more is definitely remains. Now, just a word of caution when it comes to international comparisons. And I know that very often we have the trend to compare Europe to the US. There are discrepancies in terms of what is being done as what could be called or compared as a federal overarching system, like the NIH and the European Commission, for instance, and what is done at the state level, where the member states are still the main contributors into research at the European level, in contrast to the states in the United States. So we need to be careful with manipulating those figures. But what is clear is that we can certainly take a great deal of inspiration from the NIH that decided to dedicate something like a third of its investment into neuroscience, over the last years, which certainly could be a source of inspiration. And then last, about development at a European level, and I'll conclude there, is that on the 1st of January, the Commission and the national funding agencies, together with a series of partners, amongst which EBC has the privilege of standing, we are launching what is called the European Partnership for Brain Health. So to keep it extremely simple, it's a co-funding mechanism, pooling resources from member states and the European Commission in order to then identify common priorities. The level of funding is in the range of 500 million currently over the period of time of 10 years. So I would say it is not the surge that we have been calling for and that I was mentioning is necessary, but it's still going to be extremely instrumental in the sense that it is aimed at structuring the ecosystem and seeing a cohesive ecosystem emerge across the board from basic to clinical neuroscience. I mean that it's going to be extremely important and instrumental, and we are very much hoping to see and to look for additional funding instruments that we could certainly plug onto it and then develop additional initiatives. So it's extremely important, and it's a great momentum that we see brain health being prioritized from a research policy perspective.
Excellent, Fred, and I see a request coming in for a 2026 New Year's resolution to have a European brain plan. I think the team at EBC are already pushing in
absolutely,
that vein.
Absolutely. It's definitely on our wish list for Centre.
Super, and more thank yous are coming through there. Now, I'm conscious that a lot of the burden and impact of neurological conditions has been reported on low and middle income countries. And at the moment, right now, we're talking about Europe and European solutions to European problems. Elizabeth, if I could ask you to please upgrade some of the attendees to panelists, because we do have some of the OneNeurology ambassadors on the line, and it would be great to hear some insights and thoughts. So first, Dr. Bindu Menon, could I also ask you to upgrade to a panelist? Dr. Ramla KM, Dr. Ria Goudier.
Hello.
Hello, Dr. Bindu Menon. Thank you so much for taking the time out to join this meeting and to speak with us. As some of the others are joining, Dr. Bindu, you've spoken a lot previously about the impact and burden in India, about the urban-rural divide. What are your thoughts and hopes and potential uses and impact from, I know that's a lot of questions thrown at you, but what are your reflections on what you've heard today so far?
Thank you. Thank you so much, Ola, and thank you for the opportunity to speak today. I'm a neurologist working in a semi-urban region of South India. And as a OneNeurology ambassador as well, I see that every day how neurological disorders are affecting individuals and families and communities. And most of it in the setting where I work in, I find that it goes unrecognized. Now, this report on WHO Global Status Report on Neurology is a landmark document, and it gives voice to the real burden I see. And the talks that I have been hearing now, it clearly demarcates and highlights the significant treatment gaps in the low and middle income settings also. And it also gives an evidence now that how we should be pushing neurology higher on the national health agendas. In regions like mine, Ola, the barriers are many actually. We have late diagnosis, limited access to investigations and medicines, and there's a lack of trained staff. And there is a persistent stigma as well, especially around epilepsy and Parkinson's disease. And this report, I suppose, would also strengthen our stand on the making the primary level neurological care, which I always feel is extremely important, and better training for the health workers. And you have told us that you're going to share the tools with us in the coming week or so. So probably working around that, because I see the importance of outreach models, which I do in my setting as in the monthly rural camps and the educational programs which targeting to women, and the digital tools, the apps that have been used. But then they are all in a small setting. And if it is, it's in a local setting, and that's just getting localized there, and it's not being brought to more people. But then probably if there is a and there is a module which can take this in from the smaller setting into a larger platform, because I know that all the health activities that one does is sustainable. Only thing, the outreach should be more. I thank you for this global status report. It's trying to confine everything in one place and giving us a model and a uniform framework, I should say, for action, which all of us are doing at smaller levels across. And it will help countries, my country, India, to strengthen the policy and allocate resources probably appropriately, so that this divide and the stigma-free neurological care can be given.
Thank you so much. I am conscious that some of the other potential ambassadors to speak, some of them are traveling and some of them are suddenly shy. So thank you, Bindu. If you wanted to add anything extra, we do have time. Something that was raised by you and others earlier in this call, so by you on the OneNeurology podcast, was around the influence of climate and how changes in either climate crisis or other crisis can have a significant impact on healthcare access, and that this is particularly exacerbated in low and middle income countries. Would you like to add a couple of notes to that as well?
Yeah, definitely, Ola, because, and I also suppose that there should be a sort of a seamless framework, which every department in its own standing seems to be doing well. Like if it's a pollution control board, they're doing well. The health infrastructure is doing well. The climate change, there is a teamwork over there. But what we need to have is a conversation among all of them. If that is not there, then probably the healthcare system is not getting informed when there is a likelihood of a heat rise, when there is a likelihood of a storm, of a cyclone, of a flood. Then how we should be asking our patients, and how we should be priming our patients. Probably there should be some AI tools which will help us to prime them, to keep the medication safe, ask them to get the medications in prior demand, store the medications if the heat is going to be very high, because we know that the supply chain gets disrupted during these times. So I suppose conversation across all departments, a seamless work across all departments, which every department in their own standing is seeming to do well. But then that's probably one thing I find that it's lacking in several settings.
And we are seeing more and more changes and impacts like this. A very specific question has come in for you. Now, I'm not sure if this is a comment or a question. Maybe you could comment on whether you see this actually taking place. There's a designer swab test for Parkinson's disease using GCMS. Is this being used and researched in India? Could you comment on that? That is a very specific question.
Ola, I'm not aware of it. I'm not particularly using it, so I have no idea. I'm sorry for the noise behind. Somebody's having if that's disrupting that. But I'm not aware of this swab test. We are not using it in our research as well as in our rural communities. Yeah.
Okay, thank you. Thank you. I see some messages coming in about would some of the other OneNeurology organizations and ambassadors like to speak. Abdel, I might pick on you because your name is top of the chat list. You spoke on behalf of OneNeurology and other NGOs at the World Health Assembly to push further for neurology to be included in the political declaration on NCDs. I wonder if you would like to comment on what you have heard so far.
Hi, sorry, while rejoining as a panelist, it disconnect, so I'm not sure what was the question. Apologies.
Not to worry, and thank you so much for joining as a panelist. So I mentioned the great work that MSIF have done in supporting OneNeurology and other NGOs operating in the neurology space to take an oral statement to the World Health Assembly in 2025 in relation to the political declaration on NCDs. I am conscious that you represent a huge population across the globe. And when you look at this and listen to this report on the burden and impact of neurological conditions, what are the first things that spring to mind for MS for the future?
Yeah, I think, yeah, I mean, I consider just reflecting on the what we've done, and I think it was a collaborative work because we've built a statement on the OneNeurology report, and also the statement has been shaped by the OneNeurology network to just make sure that we kind of try to get the member states behind us to ensure that the neurological condition is included in the political declaration, which is good to see. There has been a positive response. It might not have been the way that we really hoped or worked for, but it is still there is a positive outcome here by having a neurological condition mentioned. I think the report on the burden impact of neurological conditions that we tend. You know, obviously every condition has its own unique challenges, but there's also lots of similarities as we could share, you know, when it comes to being not as high priority as other conditions, non-communicable disease conditions, when it comes to budget allocations, but also sometimes even awareness within the healthcare professionals of some of the conditions. And I know you mentioned earlier, you know, sometimes the rare conditions might not necessarily been, you know, called out, and it's true, but even though MS is not necessarily a rare condition, most of the world, but there is a lack of awareness. There's that challenges that we can resonate with many other conditions. And I think having the evidence, having a burden and impact report is very useful advocacy tool, because that goes hand in hand with the lived experience. So you know, to persuade decision makers on the benefit of the inclusion and improving the healthcare for the neurological community, you need to have both the evidence that says on the long term you're actually, you're investing in the community. So it's not as suspend its investment in the community when you provide a better healthcare, and showing the burden when it comes, whether that's financial burden, whether this is employment burden, or wider socioeconomic impact or burden. And as I said, that goes hand in hand with the individual case studies, as people sharing their stories, because at the end of the day, this is about people whose neurological condition and how their life has been negatively impacted by the lack of support available for them.
Thanks, Abdel. So I am conscious that MSIF have contributed to a number of projects in supporting and generating data. And something that has just popped into my mind that I want to make everyone aware of when it comes to NCD. So the NCD Policy Lab are working on a project around access to non-communicable diseases. Neurology features in that. So to MSIF, who I know have engaged in this project, but to all of our other stakeholders on the call, if you are part of an NGO or a national or a regional entity, there is a project ongoing around access and availability to NCDs. So if you have a therapeutic agent available, or should be available to people living with the condition that you represent, there is a way to get involved in global work around prioritizing access and availability to therapies. I think Donna can attest to the fact that in parts of the world, a lot of the impact of epilepsy, for example, would be ameliorated by just having that access to treatments that are available in other parts of the world. So it's something that we can take action on effectively and immediately. So if there are any individuals or organizations on the call who want to engage and participate in that project, please do let us know, and we can loop you in with that work with the NCD Policy Lab. Thank you so much, Abdel, and I'm sure we'll see you again in the not too distant future.
Thank you.
Okay, we did very well to conclude our webinar today within time. I would like to say a special thank you to the Chair and Vice Chair of the OneNeurology Partnership, to Donna Walsh and to Karine Kastman, who have helped and facilitated the meetings, the webinars, the podcasts, and the strategy. The work of the OneNeurology Partnership could not be done without you. I would also like to thank two very special ladies who you can't see, but if you want to come on the screen, please do, to Elizabeth Cunningham and to Eva Galovich, who are instrumental in all of the operations for EFNA and for OneNeurology, and all of the communications, the policy insights that are brought to you. I have been told to make sure that I tell everybody that you can follow us on the following links. So on oneneurology.net, you can find us on LinkedIn, you can find us on Facebook, and you can find us on Instagram. And just a final mention again, that all of the tools that were either cited or presented during this webinar will be sent to everyone who has registered and attended today, and those who have registered to have access to the recording. So yeah, thank you so much. Thank you to you for taking the time today. I see some more information going into the chats there. I do see one hand raised, and this is a board member from EFNA, a clinician, Julian Spinks. Could we actually ask Julian to be elevated? It's great So those last minute insights.
I am unmuted. Hello. I just wanted to thank everybody for today's sort of presentations. They were fascinating.
My apologies. Can we see Julian on the screen, please?
Oh.
As well? Or no? Can we?
Can we?
Julian?
Sometimes it's better not to see me, you know.
Just one moment and he'll rejoin as a panelist.
Ah, super. That's great. Yes, to those questions that are coming in around the links, yes, we'll send through all of the links.
Come on. Well, my camera is on, but there's no video coming out. Bear with me 1 second. I might have to adjust things. But I can be talking as I go. I just wanted to say, it was a really good presentation, and I think there's a lot of things we need to take forward, both in Europe and worldwide, and this is a very good place to start.
Thank you so much, Julian. And we know that you're speaking as both a clinician and as an AFNA board member. We have Dr. Ramla on the line. Can we have Ramla elevated as a panelist, please? Or speaker.
Good evening. Can you hear me?
Yes, we can indeed. Yes, you're very welcome.
Thank you. I had some difficulty connecting earlier. That is why I couldn't get on time. I just wanted to mention a few things. I have introduced myself earlier. I'm Dr. Amla. I'm a neurodevelopmental pediatrician. And my work naturally is around children. In addition, I do a lot of work for school health, climate change, and global air pollution. The later part I do with the Royal College of Pediatrics and Child Health. Now, regarding the global status report, it's very welcome, and there's lots need to be done. The ultimate aim is to make brain health a reality. The earlier we do it, the better. Now, regarding children, 1 in 8 children have a neurodevelopmental disorder. And like in any other neurological disorders, the burden is very high in the low middle income countries, especially countries like India. And 80% of these children are in the low and middle income countries. Regarding epilepsy again, children with epilepsy as well as intellectual disability, 95% of them are in the low and middle income countries. And 1/5, almost 1/5 in India. So one of the most important things is prevention and promotion of brain health, as the WHO and the OneNeurology aims to. The second thing I wanted to emphasize is the social factors play a very important role in addressing these children, because the gaps are very wide, whether it be knowledge, whether it be treatment, and there's a lot of discrepancies and also a lot of stigmas and unrealistic expectations and notions regarding these disorders. So advocacy and making these children understand these important things at a very early age becomes very important. Another thing I wanted to point out is that regarding children again, climate change is becoming a huge problem. Now, in a country like India, where heat waves have become a real problem, we find that 1 degree of increase in temperature beyond the norm is causing 4% increase in premature birth. Not only this, it has got a direct impact on brain health. The last time I had told you that it is important to include brain health in school level and in school programs, and that is being done at a great level in many areas. Now, the second important thing is to include this in the antenatal programs so that the expectant mothers become aware that an increase in temperature can cause a problem for the child. So these 2 things are important. Another important thing is we have seen, according to data that is released by the global air authorities, that 625,000 people have died due to dementia that is related to air pollution. This, I'm talking about the general population. So this again comes as a very preventive thing, which all of us should be looking into. Another thing regarding children is substance abuse. The increase in substance abuse that is happening in India, especially in a state like Kerala, which is otherwise very advanced compared to other regions in India. Because of the very high literate state, you find substance abuse is becoming a big problem. So the important things I would like to conclude is creating awareness is very important. Advocacy is very important. Addressing climate change, air pollution, and substance abuse becomes very important. This is what I would like to speak about today. Thank you so much for having given me this opportunity, Ola.
You're most welcome. And if we could take some good from that, it is that creating educational tools are much easier than developing and disseminating and paying for therapeutic costs. So if we could enhance education and awareness, particularly, and again, I hate to say that it's falling on women, but to mothers especially, it sounds like a huge benefit could be derived from that. So awareness raising.
Sorry, we are doing it with Royal College of Pediatrics already, and the Indian Academy of Pediatrics has also lent a helping hand. And it'd be great if you could give your contribution too. I'd greatly appreciate that.
Anything that we can do to help, we most definitely will. Thank you so much.
Thank you.
Okay. Anyone else? There is still time if you want to have any last words, anyone. I think there's going to be a lot of digestion of data over the next while. Okay, so with that, thank you very much, everyone. And we'll be in touch to all of those who have registered for today or for the recording with all of the links and tools that have been outlined. And I wish you a very happy festive season wherever you are, happy and healthy. Thank you.
Thank you. Bye-bye.